Okay. Good afternoon and welcome to our program, The Importance of Sleep and Our Health. I'm Shanae McPherson, volunteer Connect 55 Plus administrator for Orange County Department on Aging. And on behalf of the department and on behalf of the Project Engage Mental Wellness Senior Resource Team, I'd like to thank you all for joining us this afternoon for this really important discussion about sleep and our health. So this afternoon's program will provide management strategies for common causes of sleep disruption, from sleep apnea to insomnia. We will discuss the importance of sleep and its impact on the variety of aspects of health, including cardiovascular disease and dementia. And Dr. Roth will review some of the most common causes of sleep disruption and management strategies that can be incorporated into your daily practices. So it is my pleasure to introduce our presenter this afternoon, Dr. Heidi Roth. Dr. Roth completed medical school at the Harvard Medical School and MIT Joint Program in Boston, and completed her residency at the Longwood Neurology Training Program in Boston. She is specialized in both behavioral neurology and sleep medicine. She joined the faculty of the UNC Neurology Department in 2002 and is now the Associate Professor of Neurology and the co-director of the Sleep Disorders Clinic and the director of the Aging Brain Clinic at UNC. So you can see she's very busy. So we're very excited to have her here with us. Dr. Roth's interests have included investigation of memory consolidation and sleep apnea, physiological variables underlying sleep state misperception and insomnia, and neurological models of attention, memory, and language. So if you all will join me in welcoming Dr. Roth, thank you so much for being here with us this afternoon, and I will turn it over to you.
Thank you so much, Shanae. And so, hi, everybody. I'm Dr. Roth. So glad to be here. I'm going to try to share my screen. So let's see if this works here. I'm going to start this slideshow. I think I do press that. Can you all see the presentation now? Okay. Let's see.
Yes.
Great. And I just need to get the slideshow going here. Usually it's the bottom of the screen. So I'm just going to move this over. Oh, there it is. Okay. Okay, there you are. Are you able to see my screen right now or not?
So currently we see your screen, it's not in full presentation mode.
Got it. Okay, so I've got the screen sharing is paused. So let me just figure out if I click on that. Okay, optimize, leave, no. I guess what I'm going to do is, can you all see that now? Yes. Okay.
Everything's good.
Okay. And I think we have how much time? An hour and a half? Is that right?
We do.
Okay, good. So I will talk for a while, but one of the goals I have is to be able to answer questions, because a lot of interesting information comes up when people ask questions, and I'd be happy to discuss questions, and hopefully this will be stimulating food for thought, and we can discuss things afterwards. So the goal of this talk really is to really inform you, to empower you to know more about sleep, partly to motivate maybe your own practice, as Shanae was saying, to safeguard sleep or prioritize sleep as an important part of your health, and also to give you some skills that you might be able to apply that would help you improve your sleep. I should say from the outset, I tend to not use medications. I think that very often, if you bring up sleep problems to a provider, unfortunately, people may not be informed about the best ways to treat sleep problems. But there are probably not enough people out there who specialize in the area. But typically, for example, for conditions such as insomnia or sleep disruption, most people do not require medications for those types of disorders. And I'll try to show you some of the management strategies that you can implement that might allow you to sleep better without medicines. Okay, let me move to the next slide. So the idea here, as I just mentioned, the overview for this talk is to start off with reviewing why sleep is important. We do sleep for more than a third of the time that we're alive. It might seem like a waste of time, but it may be important for various functions. And most intuitively, as you may realize, the brain is asleep, and it might be important, particularly for the brain, to have that sleep. That unconsciousness may be important. And even though we're not conscious, it can be important to know that that time that our body is asleep it's important for that to be healthy time, because things are going on at that time that are important for our health, even if we're not conscious. Because we're not conscious, I think it becomes less priority for some people. But hopefully, when you realize how much time your body is spent asleep and how important it is for your health, it'll make you think about that a little bit more. So we're going to review some medical consequences of poor sleep. And one of my favorite and most specialized interests is about memory and learning. And that's true. The relationship between sleep and memory and learning is true even independent of thinking about dementia. It's true for all stages of life, from toddlerhood to little kids, to teenagers, to kids in college, to midlife, creativity and productivity, as well as when you're older. And then the next point I want to make is about dementia and the new research that's been linking poor sleep and different impairments in sleep to potentially increased risk for dementia. But also there's certainly in the last part, well, not that it's going to be in this order, but of course, as you probably all realize and recognize, sleep is important for your mental health in terms of having more resilience and your mood. And in little kids, it can cause attention problems that lead to attention deficit disorder and that sort of thing. So that is the first section I'm going to go over, is the importance of sleep and for what aspects of our health is sleep important. Secondly, we'll talk about what types of sleep disorders are commonly affecting people, and we will focus on middle-aged and older people, since that's more what this talk is geared towards. And finally, last but not least, and I do have quite a lot of slides on this topic, so I will not skimp on that part, is the part about how do you optimize sleep. And I promise you, I'm not going to try to dumb this down too much, because I really think it is something where everybody can take an approach that can help their sleep. And the more you know, the better it is. So I'm going to give you quite a bit of information there, and hopefully it won't be too much, but I think it could be helpful for you. I actually gave a talk similar to this to a group at Governor's Club, and one of the persons at the talk implemented some of the things that were relevant to him in particular, and then came to see me in the clinic and reported that he got so much better after implementing some of these suggestions. So that warmed my heart. I know it's not the case for everyone, but maybe a few of these suggestions will help you. Okay, let's go to the next slide. So this is just a big list. And there are many medical and behavioral consequences of poor sleep. Hypertension, we can start with that. Probably the biggest association with the sleep disorder of sleep apnea. The strongest association is hypertension. So if you have sleep apnea, you're more likely to develop hypertension in the future. There have been longitudinal studies, and it's related to the degree to which you have sleep apnea, the severity of sleep apnea. Treatment of sleep apnea immediately reduces blood pressure. Because of this direct association of sleep apnea with hypertension, and sleep apnea, I should sort of back up, is that disorder of snoring or having disrupted breathing while sleeping. It is so common, it affects about 65% of people over 65. So it's very common. It's not just in heavy people, but if you have a snoring history, it's a consideration. Anyway, the sleep apnea is directly related to hypertension risk, and treatment can reduce your hypertension risk. And remember, hypertension is directly related to stroke risk. So even reducing your risk, your level of blood pressure by a certain amount will markedly reduce your stroke risk by 20%, 30%. So that treatment of your sleep can have just as much of a benefit in terms of hypertension as a medicine can, yet, it has fewer side effects, obviously. Not that you shouldn't use medicine to treat blood pressure, but it's important to think about your sleep as well. Yes, earlier death, that's an important thing to think about. They show relationships between shorter sleepers, longer sleepers, and earlier death. So if you sleep really too long or you sleep really too short, also sleep apnea is associated with increased mortality. Dementia risk. This has been a super hot topic, and if you have been, listening to the news here and there, you might have heard there's always new studies. But just this spring, I guess around in April, there was a study that hit the press out of England where they talked about short sleepers in midlife had an increased risk of dementia in the future. There's a lot of interesting knowledge about the science of sleep that makes people think that there may be a direct relationship with the amount of sleep we have and the ability of our brains to clear amyloid and tau, which is the basis of Alzheimer's disease. So I will talk about that in a minute. Stroke risk, short sleepers, increased stroke risk, increased hypertension risk, sleep apnea, increased stroke risk. Glucose control has been associated with short sleepers and also with sleep apnea. People are always interested in their appearance as we get older. So it's good to know that, healthy sleep, just like healthy exercise and healthy eating, is good for your dermatology, your appearance, and your skin. Poor sleep actually can worsen obesity. People can have altered eating habits that contribute to obesity if their sleep is poor. Immune function is a big one. You probably all know that. If you haven't slept well, you're more likely to get a cold or be easily infected by things. We're always thinking about these things these days. You might have noticed with the COVID vaccines, one of the things they recommended was to make sure that you had sufficient sleep the night before you had a vaccine. Not that it's terrible if you don't. It's not like you'll have more side effects or anything, but the function of vaccines is impaired if you haven't had sleep. Your immune response is not as robust. And that's been shown long before COVID, but just to know, that vaccines are not as effective if you don't sleep as well. Mood, there's a lot of relationships that are really interesting between depression and anxiety and sleep. And recently in the Diagnostic and Statistical Manual, which is what we use to characterize all the psychiatric categories of things like depression, anxiety, they've made a very new move to not say that depression is a consequence only of sleep disorder, but it's kind of something that can cause, like sleep problems can cause depression, and depression can cause sleep problems, but they're separate things. So if you're trying to treat depression and you don't treat the sleep problem, your depression doesn't get as well treated. And if you're trying to treat a sleep problem and you haven't treated depression, it may affect your depression. So nowadays, we don't talk as much about sleep problems as secondary to a mood problem, because the sleep problem can actually cause a mood problem itself. it's they risk they are risk factors for one another and independent in that way as well. Separate entities that have to be both addressed for optimal health. Other consequences of sleep deprivation include, and you see these in kids too, risk-taking, loss of emotional resilience, difficulty with inhibiting aggressive behaviors, loss of attention and motivation, attention problems. I think everyone recognizes that when you don't sleep well, your attention is poor. One of the things that's interesting is some people don't get sleepy with problems with sleeping at night, but they kind of lose their attention more during the day. So that's the case with kids. Kids don't really get sleepy as much so often, but they can have problems with getting hyperactive and having inattention. I think lastly, I wrote down here accidents, and that's a huge thing. So a lot of the famous accidents like 3 Mile Island or big train wrecks or plane things, people have been able to show that sleepiness has been a major cause for accidents. Driving while sleepy is very dangerous. Car accidents that happen when people are sleepy actually result in more fatalities because you don't have any control. You don't have any reflexes that can stop you as quickly when you fall asleep. So that's quite serious. Okay, that's a very long list, but I kind of went through each of those things to kind of highlight them. And I'm going to focus a little specifically on memory. I'm going to move this. Sorry, I've got you guys all in a picture here. I'm going to move your picture so I can see my slides. So memory. This is like I said, near and dear to my heart, and I think it is for most people who are getting older. But they've done a lot of interesting research into how memory is affected by sleep. And this has been the last 20 to 30 years, so not a very long time. You know, everybody probably thinks, oh, if I don't sleep well, then it's harder for me to focus and attend the next day, and I won't remember things as well. But they've shown something different than that. And that is that things that we learn during the day actually get rehearsed or reviewed at night. And those things become more consolidated and more deeply impressed in our memory while we're sleeping. So if we don't sleep as well, then that offline, unconscious consolidation of things that we were exposed to and learned recently is not going to happen as well. There was a very, highly publicized article. It was out in the New York Times and featured there, where they looked at people who are older and they related memory problems to problems with sleep. Not problems with sleep, but they said that people who slept poorly, who were older, not that they were complaining of it, but those who slept more poorly did not do as well on this memory task. And they also tended to have less frontal lobe, volume in their brains. But the point was that they do these kind of tests, which is not like having you remember 3 items and can you remember them a few minutes later. It's more about getting something the night before and do you remember it the next day, which is more important for our regular life, is remembering what has happened and what we were told over a little bit more longer period of time. During sleep, the idea that you need to have this memories consolidated relates to the fact that we can't just every day we get so much stimulation of so many different things all the time, and our synapses have to kind of be reset so we can take in more information the next day. And what happens is that while we're not awake, our brains by themselves, based on how important something was and how much we kind of paid attention to it during the day, will keep certain things and not keep other things. And this is this idea that we need the synapses to reset during the night. That's called synaptic homeostasis. There's also evolution of memory during this sleep, and people talk about creative insights they can get during sleep, so that some of the things that we learned during the day become integrated with other ideas that we've already had in our brain and reconnected in different ways. So there's some research looking at how creative thinking is really dependent quite a bit on sleeping on it, essentially. And I referenced before the clearance of toxins and byproducts in the brain with the amyloid and the tau. There's this exciting new research looking at the glymphatic system. It's not the lymphatic system, it's the glymphatic system. And what is that is the brain, as you probably know, kind of looks a little bit like the intestines. There's lots of bumps on the surface of the brain, and there's these little crevices that go down on all of these little different regions in the brain, and those crevices have fluid around them. Well, it turns out that when we sleep, the crevices get a little bit bigger so that the fluid can penetrate a little bit deeper. And that allows for more clearance of byproducts of things. And that's one of the reasons they think that sleep is important. And they did quite a lot of studies in mice on this topic. And they were able to show that if the mice didn't sleep, the amyloid wasn't cleared, and then more amyloid, which is kind of one of the hypotheses about Alzheimer's disease, was actually deposited in the mice's brains. But if they were allowed to sleep more, that didn't happen in the same genetic mice. Okay, so let's move to the next slide. Okay, and here I'm showing the different features of sleep on this slide. So you can see in the beginning, there's this circle. I don't know if you can you see my arrow going around? Anyway, do you see my arrow? Anybody?
Yes.
You do, okay.
Yes.
So this is going across the night. That's starting at midnight, and I'm sorry it's so small, but it goes all the way to 7 in the morning. So in the beginning part of the night, you have what's SWS is slow wave sleep. This is called a hypnogram, which shows the stages of sleep. But you get into what we call this deep sleep period here in the beginning of the night. And the end of the night, you have REM sleep, which is the dream part of sleep. So if you're having a lot of dreams, you might notice that the dreams are more likely to be in the later part of the night, like between 4 to 6, you know. And that's because there's more REM-rich sleep at the end of the night. And so we have REM sleep in the beginning of the night, you see, but they get longer and longer as far as you go. And then the slow wave sleep, you do have it at the end of the night, but it's shorter. So it kind of evolves to having these different stages, but the proportion of them changes over the course of the night. And if you have acting out of your dreams, okay, some people do later in life. We could talk about that if somebody experiences that. It's typically something that happens in the last part of the night. Now, if you have sleepwalking, which is when you kind of wake up but you're not fully awake, that's sort of slow wave sleep. That's over here where people wander around and do things for, you know, longer periods of time. That happens in the beginning part of the night. Just a little tip. Okay, next slide. Okay, so what I'm showing here is that you can see this is the same kind of idea with the slow wave sleep in the beginning of the night and the REM sleep in the end of the night. And what they did is they tested memory for some word pairs. These people were asked and given these pairs of words, which said like animal, dog, bird, eagle, you know. It might say, you know, like furniture, sofa. And then in the morning, they were asked, okay, furniture, what was the item associated with furniture? So they were learning these associative categories to an item in the category before they went to sleep and then when they woke up. Now, it turned out what happened was if you do that over the REM period, it doesn't really help you as much. But when you do it over the slow wave sleep period, when you do that, people remember better the next day than they do if they didn't have that slow wave sleep. Or if you do it over the same interval when you're just awake during the day, like 4 hours while you're awake or resting, but not asleep, you also don't get that relatively improved memory. These are some graphs showing that percent improvement when you're over the early part of sleep. You see that bar goes way up. There's another test they did, and it's a little complicated here, but they did another kind of learning, which seemed to be better over REM sleep. So there may be different roles for different parts of sleep. This was motor learning that seemed to be improved when it was over the REM sleep period. And I've done some different kinds of research that looked at these components and differences in the components of the different parts of sleep. But for regular, what we call episodic memory, the kind of thing that you think about, like what did I eat for breakfast? What did they tell me about something? That's usually considered to be happening over there in slow wave sleep. Okay, this is just I only put this, and we're going to get over these abstract slides and back into the practical stuff in a few minutes, but I just thought I'd review these things that were important about understanding why it's so important for memory. You see this little white bar here? This was a task that's something that when you sleep, you do much better the next day. And so you can see they did this test and then they slept overnight. It's called the Visual Discrimination Learning Test. Anyway, when they did this test and they slept overnight, and then they were tested after sleep. One day after sleep, they did that well. If they were tested 2 days after sleep, they did this well. 3 days after sleep, they did this well. 4 days after sleep, they did this well. 5 days after sleep, they did this well. So they did keep, they weren't tested every day, but if they were only tested, like, so they got sleep and then they were tested 5 days later, they did well. If they got sleep and they were tested 2 days later, they did well. But if you didn't let them sleep that first night, they can't do it so well, even if you test them 3 days later. Of course, if you didn't sleep and you just test them the same day, they also don't do so well. But the point of this whole thing, I don't know if I'm explaining it very well. The idea here is you can have them sleep the first night and they consolidate the information. So you can test them 1 day, 2 day, 3 day, 4 day, 5 days later. They still have that information in their brains because it got consolidated. But if you don't sleep that first night, it really doesn't improve, even if you sleep the second night and the third night and the fourth night. So the idea here is you just obviously don't want to do an all-nighter. That there's something important about having that sleep in a regular cycle after you experience things that helps consolidate it. Okay, and this like somewhat busy slide was just to kind of communicate to you the excitement people had some years ago related to the glymphatic system and sleeping with the brain's housekeeper, sleeping out these toxins, and you see that red dye is sort of penetrating the fluids during sleep, and it's incredibly much more penetratable when you're asleep. It's like 90% more. Here you can see the percent. The CSF flow goes up about 90% into these areas versus when they're awake. And this over here is showing that normally when we are sleeping, the amyloid goes up. And then when we're awake, the amyloid when the amyloid goes up while we're awake, but it goes down while we're sleeping, even in younger people. But so the idea is though that at night, the amyloid may be being broken down by the sleep process. It's also true that we generate less amyloid when we're sleeping. So there's two components to that. Okay, now I'm going to transition to sort of more practical tips, but that was to kind of motivate you on a whole slew of topics related to health and sleep, with a little bit of an emphasis on memory and sleep and dementia mechanisms and sleep. This here is just one of the biggest reminders about accidents. At people at all ages, sleepy driving is huge, causes a lot of accidents per year. They tend to be very, very serious accidents. So if you are sleepy, don't drive. And if you're sleepy all the time or a lot of the time, and you can't, be sure that you're not going to be sleepy suddenly, you really shouldn't drive, but you should also get your evaluation for sleep problems, because you could both kill yourself and somebody else, which you wouldn't want to do. This is actually, this is a very lovely book that was near and dear to my heart. I picked up at the airport one day, and in the foreword, they talk about how this young woman, after graduating from Yale, she discusses her experiences there, did get in an accident where her boyfriend fell asleep at the wheel and she died. But the friends of hers compiled her short stories and her writing, and the title of this book is just about how she felt in college. She called it The Opposite of Loneliness. and it's beautiful writing, very interesting, but it is very sad at the same time. And it really, and the parents were very, very forgiving of her boyfriend, and, understanding that it was really no one's fault. But this is something that, if we're all more aware of, we can prevent horrible things from happening. Okay, so this is getting to the practical side of things. Maybe I should stop here for just a moment, just to see if there's anything coming up in the chat. We can always save it for the end, but if there's something that is coming up right now, I'm happy to maybe address it right now.
I don't have anything right now, Dr. Roth.
Okay, no worries. And also, I typically like to give talks in person, but I know we're, unfortunately, in the circumstances we are. You may feel free to speak up and ask a question at any time. Happy to take questions during the talk since we have enough time. So I was trying to tell you here that sleep is like fitness. You can learn, to make sure you go on a walk every day and stay fit. Sleep is something that you can take charge of a little bit and make a difference, but it is important to understand the mechanisms of sleep in order to not do things that might backfire, that you might think you're doing, like, oh, I need to go to bed earlier, that's going to help me. Sometimes it doesn't help you. So I'm going to try to kind of point out how to best address the sleep things to make it better. I think this is important for every stage of life, but as we get older, little things make more of a difference. We're more vulnerable to the effects of little things, including medications, including, if you get the flu or something like that, it's going to really put you off a little bit more than when you're younger. So if your sleep is not good, it can also be more of a factor in your ability to function. Okay. How common are sleep problems? Incredibly common. 26% of people complain of difficulty falling asleep, 42% of people difficulty staying asleep, but only a small minority of people really go to a doctor and ask for treatment. So most people are addressing these things on their own. 10% of people in the whole population meet the criteria for chronic insomnia disorder at some point in their life. So this is incredibly prevalent. Obviously, a lot of people don't get treatment for it. So now I'm going to address with you these different types of sleep problems, which I've kind of simplified here to address in a little list, and we're going to go over each one. Obviously there's more than this, and I could talk to you about more things if you had a specific question, but these are basic things. So we're going to talk about problems falling asleep, and then we're going to talk about problems staying asleep, and then we're going to talk about feeling too sleepy the next day or feeling tired, and then we're going to talk about restless leg syndrome, since it's a pretty easily treatable thing and it's pretty common and it's comorbid with problems with sleep. And then we'll talk about concerns about sleep apnea, which is very prevalent and a pretty treatable problem. And I wanted to kind of open your eyes to the fact that there are lots of different options for treatment. Everybody kind of has this fear of having a mask, but it's not a big deal. And there's some other options for how you can treat that too. Okay, next one. So before we go on to the 5 different things, which is falling asleep, staying asleep, sleepiness, restless legs, and sleep apnea, I need to establish with you just the basic physiology, the natural sleep rhythms, because it helps us understand how to make our natural sleep rhythms work for us to improve sleep. Okay, so the classic story in sleep is that there are 2 main sleep rhythms. The circadian rhythm, I'm sure you've heard about. That's this rhythm that's like the clock. If you go to sleep at a certain time at night, you might start to feel sleepy around that time again the next night. And so, if we wake up at a certain time in the morning, then we might be more likely to wake up in the same time in the morning the next day. I just want to point out that the circadian rhythm is much more, what do I want to say, deeply biologically ingrained in our body than you may be realizing. So basically, even if you take a single cell out of your body, like a white cell, a blood cell, you can look at that cell and analyze what your circadian rhythm is from that one little blood cell. Because every little cell in our body is on a circadian rhythm. There are these clocks in our body in every organ. Like our GI system is on a clock, and all the cells in our GI system are on a clock. All of the bladder is on a clock. And all of our liver is on a clock. So everything's on a clock. And basically, there's certain kinds of proteins in cells that build up and they create a clock because they create products that then only cycle kind of over a 23 or 24-hour period that put all the other proteins that kind of control when they're made. So their Nobel Prize was given for this work recently. This is so deeply ingrained in all of our cells that, people have realized recently that giving chemotherapy, you might want to give at certain times of the day to reduce side effects and increase efficacy, because you want to catch the clock at the right time in those cells that you're targeting. All right. So if you think about it, if your clock is off, when you have jet lag, you're going to feel really sick to your stomach. It's a very common feeling. And the reason you're sick to your stomach is your GI system is off. It's not at the right timing. Or you go to Europe and then your bladder is going off at the wrong times, because normally our bladder is on a circadian rhythm so it doesn't pee at night. I know that some people feel like they have to get up at night a lot of times to pee. That's something you can remedy, but there is a natural sleep rhythm where you don't drink as much or don't eat as much at night, and that helps your body systems be on the right circadian rhythm. Okay. About the circadian rhythm, it is something interesting in that actually in the morning, you don't kind of need as much alertness, but the circadian rhythm actually pushes yourself into alertness more in the later part of the day after the dip. But when you're getting more sleepy, the circadian rhythm is kind of pushing you up. And it's when your circadian rhythm doesn't have enough alertness and your sleep drive is too strong that you get sleepy. But anyway, we'll put that aside. And the clock has a super master clock in the brain, which I'm sure you've heard about, the suprachiasmatic nucleus. That's supposed to coordinate all the clocks in our different organs. Of course, that could get a little weak, and then our organs can't rely on the suprachiasmatic nucleus clock, and we have to be even more careful about making sure our organ clocks are in sync. Okay, second big natural sleep rhythm is the homeostatic sleep drive. This is the sleep pressure that builds up the longer you haven't slept. This is a basic concept. So if you haven't eaten for many hours, you get more and more hungry. Same thing with sleep. You haven't slept for many hours, then you're going to get more and more of a drive to sleep. It builds up the longer you are awake. And there's various, physiological principles about this. One of them is caused by adenosine buildup just from the energy metabolism in the brain. Builds up adenosine, which builds up the sleep pressure. And just so you know, caffeine blocks adenosine, okay? The other thing to keep in mind is that, so your sleep pressure goes down if you drink caffeine. If you take a nap, say in the middle of the day, then you kind of tamp down your adenosine. So you're not going to have the same sleep pressure in the evening. And I'm not saying it's bad to take a nap, but if you're having trouble falling asleep at night, then you need to think about taking a shorter nap, right? Because you're absorbing up your sleep drive at night. Okay, so these are so important. I kind of spent a while telling you about them. Let me look at the time. Okay. So I realize I'm speaking very thoroughly and carefully, and time is going by quite a lot, but let me get to this is the practical things. So we have those 5 things I'm going to talk about. Problems falling asleep. Let me see what I wrote here. Yes. So if you're having trouble falling asleep, the things that you need to know in order to consider why this might be is you have to know your personal circadian preference. Are you a night owl or a morning lark? And you have to know your personal individual healthy sleep need. Not everybody's the same. I mean, you hear in the news all the time, you need to have 8 hours of sleep. True, it's kind of average, but there are people genetically who need less sleep, and there are people genetically who need more sleep. So you need to know what your healthy sleep need is. And if you're getting to bed at 9 and getting out of bed at 10 in the morning, you're in bed for 13 hours. You're not going to be falling asleep because you don't need quite that much time. So you have to have the right kind of sleep window for your healthy sleep need. Watch out for factors that work against the sleep drive. We talked about caffeine, right? That blocks the adenosine that helps your sleep drive. If you're having a problem falling asleep, my recommendation is always to eliminate all caffeine. Caffeine has effects for 24 hours. So even if you have tea or iced tea in the morning or soda any time of the day, it can be affecting your sleep at night if you're having troubles falling asleep. Now, there are people who don't have trouble falling asleep, so they don't need to think about this. But if you're having trouble falling asleep, then you need to think about this. Then you remember what I talked to you about the naps. If you take a nap, or you're maybe unintentionally dozing off today. So a lot of people in the evening might sit down and watch television, which is fine. I have nothing against that. But if you happen to be dozing off while you're watching television and then you can't sleep at night, that's a problem because you're kind of sponging up your sleep drive right before you're going into bed. So it's no wonder you can't fall asleep. So in those cases, you need to make sure you're in a little bit brighter room on a less comfortable chair so that you're not going to be falling asleep, or you do something a little more active if you really can't prevent yourself from falling asleep before you get into bed. Another factor that could be affecting your sleep drive is extending your sleep in the morning. Like you're saying, oh, I didn't feel like I sleep that well, so I'm going to sleep in or stay in bed for a little longer till 11. Well, then your body's not going to be ready to go to bed whenever you might want to at night, probably because you don't build up that homeostatic sleep drive, that sleep pressure. Even if you're not asleep, you're still resting, and that counts too. So then there's the little things on my checklist here are other things that can interfere with sleep. Okay, you really need to have these things checked off your list. You need to make sure you don't have restless leg syndrome. And are you getting exercise during the day? And then sorry, this is in my way. Eating before bedtime. You know how I talked to you about the circadian thing with eating? You really don't want to have eating or drinking in the 3 hours before bedtime. And that's because you remember you want your bladder and your GI system to be working on the right circadian rhythm too. So I typically tell people not to have water. They can have a gallon of water at 4 hours before bedtime. People say, I need to be hydrated. My doctor tells me to be hydrated. You can drink 40 gallons. No, you shouldn't drink that much, but you can drink a couple of gallons of water if you need to, but just not in the 3 hours before bedtime. So if your bedtime that you're targeting is 11:30 or 11, count backwards, 10, 9, 8. No fluids after 8. If you need to take a little pill or small amounts of pills, you can just take a small amount of water with those. Always make sure you have a wind down of 30 minutes before bedtime, not watching television or doing things like that. Maybe being present in your physical environment, putting things away or getting ready for the next day. And of course, you want an environment that's quiet at night without clocks or TV or pets in the bedroom, ideally. Okay, so that's some general concepts about falling asleep. But the main thing, which I'm going to focus on, because this is the key thing, super effective. If you're really having insomnia, this is what works. So basically, this is called the sleep window. And basically, you need to figure out, like I said, what time, are you a morning lark, a night owl? If you're a night owl, you've got to think about what time you would like to go to bed, and then think about what time you would like to wake up. If you're a night owl, midnight might be an okay time to go to bed. But now, how much is your sleep need? When you were 40 years old or 50 years old, remember way back when you were sleeping pretty well, how much did you sleep and you get by with and feel pretty good with? It depends on the person, but this is an example of one where you have a sleep window of 7 hours. And if you've got a problem with falling asleep, you sometimes want to shrink that down a little bit to help with that sleep drive to push you to sleep. So the idea here is you make sure that you only sleep inside the window. So you're not allowed to go to bed early and you're not allowed to get up late, but you're allowed to go to bed later and you're allowed to get up earlier, if that makes sense. If you look at this little picture here with the lines, so if your sleep window starts at midnight, you can go to bed anytime after midnight, but you have to get up before 7 or 7, but not after. So sleep can't be outside the window is the idea here. This is absolutely powerful. If you're having a sleep problem, this will fix it quite well. Too often people are going to bed at, and I could give you anecdotes, at 9 because they're having a sleep problem. But if you go to bed at 9 and you're getting out of bed at 7, that's too much time in bed. Your body's not ready to go to sleep at 9. If you want to go to bed at 9, 10, 11, 12, you might need to get up at 5, okay? That's a choice you could make to go from 9 to 5. But if you're going to get up at 7, you might need to go to bed later. Okay. So you tailor the sleep window that you might target snugly to fit your sleep period and according to your personal circadian rhythm and sleep need. One of the key things about this, and this is the tip, is if you have a bad night's sleep and you're using this sleep window technique, you have to make sure you get up at the same time the next day, even if it's a bad night, because it's like money in the bank. It'll help drive your circadian rhythm and make it more in sync, and it will increase your sleep pressure for the next night. It'll help stabilize your rhythm. So they've done these studies in people with insomnia where they keep them up all night and keep them up all the next day, poking them in the lab, making sure they don't fall asleep. And then they go to home and they sleep for 2 weeks really good. So it's sort of like jump starting your system. So if you have a bad night, it helps it actually works as a bit of a jump start on your system to sleep better. So the main goal is not to extend your sleep in the morning after you have a bad night. Okay, that's this concept of the sleep window. If you don't remember anything else in this talk, the sleep window is extremely powerful. Just to go back here, we also talked about caffeine, naps, and dozing in the morning. Okay, so these are some general mindset tips about sleep that are helpful if you're having trouble sleeping at night. If you have a bad night, the next day may be fine. If people have insomnia, they'll know this, that some days they have a terrible night and the next day they actually feel pretty good. It doesn't always correlate. And sometimes if you're tending to worry about things at night, you might think it's better not to think that it's going to be a bad day the next day because you don't know if that's going to be the case. So this is important. Another important mindset tip is you can't make yourself go to sleep. So you can't say, oh, I wish I could go to sleep. I've got to go to sleep. No, what you have to do is just stick with the sleep window principle, and your body rhythms will support your sleep. Sleep is a system that has to happen naturally. You're not responsible for your sleep. But if you put these things in place, then your body will naturally help you get to sleep. And I said elimination of activating substances and working on your sleep drives with a sleep window is what you focus on, not on making yourself go to sleep. The other thing, a principle that I have is you can rest comfortably in bed without being unconscious during your sleep window, and that's fine. That has restorative value. You don't have to get up and leave the bedroom unless you're frustrated or worried. There's a lot of research in sleep where they say, well, if you're lying in bed and you're not sleeping, you're feeling anxious, you got to get up and go to another room and read a book until you're tired and come back to bed. But all I'm saying is that if you're in your sleep window and you're just relaxed and daydreaming, but you're not asleep, that's actually fine. You don't have to get out of bed at that point. Do not have a clock visible, including a cell phone. It's a very basic thing to know. People look and they want to know how much time is left. But all that kind of engaging in time thinking is sort of a different mindset that is not as good for getting into that kind of flow that you get into when you're in this sort of relaxed state. And that'll interfere with your ability to have restorative rest. You can set an alarm for the wake-up time. Setting expectation. Realize that your sleep may not be perfect. And if you're trying to improve your sleep, it will be small steps that you'll see that will improve you in the right direction. It's not going to be, some people have a little bit poor sleep. They're not going to sleep like Joe who hits the pillow and he's out for 8 hours. If you tend to have a little more arousal, you're always going to have that. But these tips can push you in the right direction. Okay. So again, this is just a review. We have these two types of the circadian rhythm and the homeostatic sleep drive. And we talked about setting an optimal sleep window. And I think those are important things to remember as the principles I'm telling you here. And then the caffeine is the biggest sleep disruptor. You know, if you get Starbucks caffeine, it has much more caffeine than a regular coffee. All of these things have caffeine. A decaf Starbucks has as much as some regular Maxwell House almost caffeine. So, you know, if you look at, say, Starbucks with 260 milligrams of caffeine, that is how many times? 6 times as much as a Maxwell Health coffee. So there's a huge variation in how much caffeine are in these things. So just be careful to recognize that all of these, and if somebody has insomnia, any of these is going to disrupt sleep, including for sure black tea or green tea even. Okay, next one. So just one coffee in the cup of coffee in the morning if you have a sleep onset problem, that is not okay if you have sleep onset insomnia that's bothering you. Okay. Sleep disruptors medications. This is important. Of course, when I see people, I'm always looking for these things. If you're taking an SSRI, which is very common, it's very good medicine like Zoloft or Celexa or something for mood, you want to take that away from bedtime. Typically, if you're having a sleep problem, there are some that are really meant to go at bedtime, like Remeron or mirtazapine or trazodone, but the SSRIs like Zoloft and Prozac and this Celexa and Lexapro, citalopram, those ones should go in the morning. Beta blockers, which are very common for blood pressure medications like atenolol, metoprolol, those can contribute to insomnia at night. If you're taking Synthroid, it's better to take that in the morning if you're having sleep problems. If you're ever having memory problems, somebody puts you on Aricept or Donepezil, that can really cause sleep problems in 30% of people. In general, I say avoid medicines at bedtime, even multivitamins. It's better to take them in the morning and allow your system to get GI rest. There also is this restlessness story, the restlessness tendencies. And if you have that restlessness spectrum tendency, there's things that can really make that worse, including Benadryl and over-the-counter sleep aids can really make these people go crazy, and amitriptyline and hydroxyzine. Beware of opioid pain medicines, muscle relaxants, and benzodiazepines. First of all, they're terrible in aging, have tons of bad side effects, and they also cause sleep apnea. Don't forget the sleep environment. Okay, temperature, you want it cool, dark, quiet, and alcohol. Alcohol, if you're needing this to go to bed, it's not so good. It mainly causes sleep maintenance problems. It wears off, and then you have less good sleep for the rest of the night. It can worsen sleep apnea, can worsen restless leg syndrome, can worsen dream reenactment, does not improve sleep quality. It can help anxiety in the short term, but it wears off, and then it's better to try other treatments to manage anxiety. I'm not saying that alcohol is always bad. I don't think there's a lot of evidence that it really helps a lot with health, and it certainly doesn't help with sleep. So, you know, consider if you're having a sleep problem, the potential downside of alcohol. Sleep aids. These are the medicines people give for sleep. There are problems with sleep aids. You might think, oh, sleep is so important for my memory, I should use a sleep aid because I can't sleep. No, don't use a sleep aid because these cause problems, including sleepwalking, sleep eating, falls, grogginess. And in fact, they have been shown, in fact, to increase risk for dementia in epidemiological studies. So you want to try to avoid those if you can. You certainly, clonazepam, Ativan, Valium, Klonopin, Trazodone, mirtazapine, all, anyway, some of these can make people, you want to try to avoid them if you can work with the principles we just discussed. Okay, now the rest of this talk, I know it may feel like we're going to run way over time, but I think I can finish this in a few minutes. It's about the same principles we're going to be talking about, although I'll throw in a little bit about sleep apnea at the end. Problems staying asleep isn't that different than problems falling asleep. You're going to use the same principles. So again, look, I'm giving you the same slide with the same things. What is your circadian preference? What is your individual healthy sleep need? Are you using caffeine? Are you napping? Because sometimes people have enough of a sleep drive to get them to sleep, But because the sleep drive isn't strong enough, it doesn't extend through the night. So you need to try to build up the sleep drive as well, or you're in bed too long. So it's exactly the same slide. Look at that. We've already gone over it. So it's the same things. Too much sleep time in bed for your sleep need. So you adjust your sleep window. You're dozing off at night, then you're not going to have as much sleep drive. You're going to bed too early. You're taking naps. You're getting caffeine or alcohol or medications, and same things as before. The only thing that you add to the sleep maintenance issues is you have to think about the key sleep disruptors, because sometimes there are things in sleep that happen that wake you up. Okay, here's my list. Nasal congestion. If you have even mild nasal congestion, that could be contributing to snoring and sleep problems. You could use a nasal steroid spray like fluticasone over the counter. Don't use those acute ones that cause rebound like Afrin, but a nasal steroid spray can be helpful. Snoring. Are you a snorer? If you are a snorer, then do think about sleep apnea, because 60% of people over 65 have sleep apnea. Common cause for sleep maintenance if you're waking up a lot during the night. Reflux can be a silent factor. You may not feel the acid, but it could be causing sleep disruption. And I can't go into all the details, but you can have people have maintenance insomnia and you can't think of any other cause, and you can take a little probe, go down in their esophagus, and it turns out actually they are having reflux even though they didn't feel anything. And if you treat them with a proton pump inhibitor, their sleep is much better. But another thing you can do is just stop eating and drinking 3 hours before bedtime, and that does help that. If you're having pain at night, do not use opioid medications, but consider Tylenol arthritis. Nocturia, very common. I know people use a lot of medications for this, but first of all, please try to avoid strictly water 3 hours before bedtime. Treatment of apnea can also help with nocturia, and you see a lot of improvement with that. Don't dose your diuretics at night. That will help that too. So that was all on sleep problems waking up during the night. Then we have excessive daytime sleepiness. This is the scoring sheet we use. Like, how often do you doze off when you're sitting and reading, watching TV? Do you have a slight chance of dozing, a medium chance of dozing, like sometimes, or a high chance most of the time you'll be dozing off? These are the different scenarios that we do. And if you score more than 10 on these scenarios, we think you have some increased sleepiness. What could be causing sleepiness in the day? It could be related to a sleep disruptor at night. I wrote most likely cause. People have insomnia, pure insomnia. Like I said, can't fall asleep. They don't fall asleep. So they don't fall asleep in the day either, typically, unless you have a combination of factors. If you're having a sleep disruptor, like you're having apnea or something, that can give you more sleepiness. So think about that. It could be due to problems with circadian rhythm. That's another very likely cause. Like, say you are naturally going to bed very late, like at 2 or 3 in the morning, and then suddenly you have to get up early because you're going to an appointment. And so the kind of activities you have to do are not aligning with the sleep schedule that you're on. That could make you very sleepy. Medications can cause sleepiness. This is like half of what I do in my clinic, is to try to reduce medicines, but muscle relaxants, opioid medicines, benzodiazepines, Lyrica, clonidine, Elavil, all these things can cause sleepiness. Another one is insufficient sleep. That's very common in young kids, college, because they're just too busy. They don't sleep enough. They don't prioritize sleep. And then you can kind of increase the sleep period and time to see if that helps. It's not as common in older people. Excessive sleepiness is not usually due to insomnia. Okay, but there can be sleepiness in particular conditions like Parkinson's related sleepiness that's not related to the nighttime sleep. Here's the body clock. Remember how I said the different organs, they're on a clock? I just have this picture here I put in with all the organs having their own clock. Light can advance or delay the clock. And so that's why we talk about getting light in the morning to get your day started. But you don't want to get a lot of light before bedtime if you tend to be a night owl, because that could make you go to bed even later. And you can see these plants here that even if you put them down in the box so they don't get the sun, they remember when it's daylight out and when it's nighttime. So it's inside our bodies, even when we're not exposed to the light later. That's how it gets ingrained. Older people tend to have an advanced sleep phase. They tend to wake up a little earlier and want to go to bed earlier. But we can help with that by increasing light at night, And so light becomes an important factor in terms of modulating the clock. So last but not least, I was just going to mention restless leg syndrome and sleep apnea. 5 to 15% of older people have restless leg syndrome, and over 60% of patients with this condition have insomnia. 45%, so that's almost half of older people, have what we call periodic moments of sleep. It's not just feeling restless, it's like there's a little movement of the leg every 30 seconds, like a clock. And so you can have those 100 per hour and not even know it. Those can cause some sleep disruptions sometimes and sometimes not. The limb movements of sleep does not mean you have restless leg syndrome. Restless leg syndrome is when you have some experience of feeling restless before you go to sleep. Okay, now 45 to 60% of people can have sleep apnea. What is restless leg syndrome? It has 4 features. It's a clinical diagnosis. You don't need a sleep study. It's a feeling of body tension or sensory discomfort in the urge to move at night, typically worse at night, or a tension or pain that's worse at night, or discomfort that gets better with movement. Typically it gets better with movement, and typically it's worse at night. Those are 2 features. Typically it's worse when you're unable to move, like in an airplane or a long car ride. It definitely gets better when you move. And again, it's not worse in the morning, it's worse in the evening. It has a circadian rhythm to it, and it's kind of worse when you're going to sleep. Caffeine can make this worse. Not getting exercise can make this worse. Some medicines can make this worse, including Benadryl, especially, like Tylenol PM. Alcohol can make it worse. SSRIs at night can make it worse. Stretching can make it better. And finally, iron. It's good to check iron. You really want to have iron supplementation, even if it's slightly, the ferritin is slightly low, that can have a big effect. If we have to use medication for this, we use low dose gabapentin at night, and that can be also helpful. Sleep apnea. Remember, sleep apnea is associated with blood pressure problems, dementia risk, stroke risk, depression, reduced energy. And it doesn't mean that you have to be really obese to get sleep apnea. And you don't have to be sleepy during the day. The majority of people with sleep apnea are not sleepy during the day. So just keeping in mind, if you're a snorer, this might be something to consider, even if you're not obese and even if you're not sleepy, but you just might notice some restlessness that you might think is insomnia. In fact, it's actually sleep apnea that can be fixed, and you'll feel better during the day and you'll have these reduced health problems. So if you have restless sleep at night and tendency to snore and hypertension, you have a high risk, fairly high risk. If you have a tendency to snore sometimes, and if you have a family history for sleep apnea, it would make it more likely. If you're having awakenings at night, increased urinary frequency at night, a morning headache tendency, a restless sleep at night, occasional night sweats, moving around in your dreams, those can be associated with sleep apnea too. Those are sort of signs that you might want to get a sleep test. What is sleep apnea? It's basically when you're breathing in and you're asleep, your airway collapses. It's not normal. It's very common, but that doesn't mean it's normal. There are no animals in the animal kingdom where their airway collapses when they're sleeping, but it's something, except for a few, but it's something to do with the vocal tracts being able to talk, that we evolved this way, but it's really not a good evolution. And so it's not a positive thing. And it's that, we close our airway when we're sleeping slightly. This can leads to oxygen desaturations that can affect your body organs, and also cause microarousals, which disturb the quality of sleep. There are different ways we score it, and we score it in terms of apneas and hypopneas. Apnea is a partial blockage of your airway, and hypopnea is more like just that you reduce the flow. Less severe apnea is 5 to 15 per hour. More severe is 15 to 30, moderate, and 30 or greater is severe. But you can have an AHI of 5, and it can be very bad because it's causing severe desaturation. So the number doesn't tell you everything. What are the options for treatment of sleep apnea? There's lots of options. Sometimes people don't even have it when they're on their side. There are dental appliances that move the jaw so that your airway is open. Nasal congestion treatment can be very good treatment. The Cpap mask can also be good. And I've had people who've had concentration, attention difficulties, or other symptoms, and then they found out they had severe sleep apnea and they had no idea. They got treated with a Cpap, And they just feel like it made a huge difference, in addition to the health benefits, of course, that we know exist. So I had one man who was heading to the beach for the weekend, and he didn't bring his CPAP mask. He got all the way there, but because he knew his whole day would be off if he didn't have it, he drove all the way back to Chapel Hill to get his mask and drove all the way back to the beach to have it. So people who really benefit from it, that's from a cognitive perspective, but again, their health risks even independent of that. This is an example of you can see these different colors. The red is REM sleep at the end of the night. Pink is slow wave sleep at the beginning of the night. And this is somebody who had a lot of respiratory events, these little tick marks. And this is the oxygen saturations going up and down and the heart rate going up and down. And then he got put on CPAP therapy, and look at this huge long REM sleep period. And there's the CPAP levels, and his oxygen levels then became very stable, much more stable the second part of the night. And of course, he felt much better after he got this CPAP therapy on the split night study. Everyone is, okay, so this is the summary about sleep. Every person is different. What one person might need may be different than another. There's a range of sleep needs. You have to think about your physiology, what your problem is, and think about the natural sleep drives and might be what's best for them. What is your general sleep need? Are you more of a night owl or morning lark? Do you have more insomnia tendencies? Do you need to be more careful about stimulants? Key takeaways, there are consequences of healthy sleep. You get better creativity, learning, emotional intelligence, cardiovascular fitness, immune function, to name a few. Sleep fitness is not about medicines. It's about understanding physiology, avoiding stimulants, scheduling things correctly, and addressing your individual sleep tendencies. Be aware of making sleep expendable. So make it a priority rather than just sort of default, the sort of what you do when you're not doing your other many things. Be aware of sleepiness and driving safety. And in terms of this talk, if you can think of just a few things to try, you might be able to see if they have an effect. Keep in mind the goals for sleep fitness and establish routines based on sleep health principles. And in middle age, people sort of think less sleep is almost a badge of honor, like, oh, I'm working so hard, I'm not sleeping, but it's really a liability and a weakness and a sign of poor health. Okay, so we went over sleep onset, sleep maintenance, daytime sleepiness, and the fact this is a matter of fitness. So I think from that, I'm going to just let us do questions. We have 20 minutes for questions, I guess.
Yes. So thank you so much, Dr. Roth, for that presentation. And we had several questions that came in via the chat.
Okay.
So we'll get to those. And I'll go ahead and get started and start running through several of those questions. So the first one that came in was, how would I know that I have a sleep problem if I feel okay?
Well, if you don't have any daytime sleepiness and you go to bed and you fall asleep fine and you sleep through the night, and you don't have snoring or hypertension, you probably don't need to think about sleep. There are people who sleep well. I don't think if you're really not having any symptoms at all, then I think that's sufficient to be reassured. If you are having daytime sleepiness, but you feel like your sleep is fine at night, that's not necessarily reassuring, because that's a symptom of problems of your sleep-wake cycle, and it may indicate that you have sleep apnea, you're not aware of it. But if you function perfectly normally during the day and you sleep well during the night, I don't think then you have to do any extra work with that. Well, if you maybe, of course, you can't be taking sleep medicines. If you're taking sleep medicines, that's another indication that you're having a problem for which you're trying to get treatment. Does that help answer that question?
Mm-hmm. Okay.
Yeah.
So the next question that came in is, if I snore, does that mean I'm really not getting quality sleep?
I think you have to be quite careful about snoring. So if you're a snorer, a reasonably loud snorer, and you are over 50 and you have high blood pressure, you're really pretty reasonable risk for sleep apnea. So with the snoring factor, if there's anything else that you've got on your list of things like a hypertension, you probably want to get checked. I think I have a low threshold for getting checked for sleep apnea. I think it can really benefit your quality of life and reduce risk for medical morbidity if you are a snorer. You can try treatment of nasal congestion as sort of start off, and sleeping on your side while you're waiting for an assessment, because those two things together can hugely affect your breathing at night. So sleeping on your side and using nasal steroid spray may be very beneficial.
Okay, thank you. And the next question that came in, there are a couple, so we're going to move through a lot of these. They're coming in the chat, which is great. So does clearance happen during a particular phase of sleep?
No, I think that slow wave sleep is thought to be the most important part of that. I think slow wave sleep is probably what there's probably the most. I think all sleep is a little bit, but slow wave sleep is probably the most critical part of that clearance.
Okay. Next question is, does the fact that I take naps during the day mean that I'm not getting quality sleep at night?
It depends, but I think it may be an indication. If that person is taking naps, do they feel like they sleep well at night too? If they're sleepy during the day and they're very sleepy at night, then it could be that they do have sleep apnea. I don't think that people should be sleeping during the day, even when they're sleeping at night. It could also be that they have medicines that are making them sleepy. So that's another thing to consider. Parkinsonism itself, Parkinson's and related disorders, can cause a primary hypersomnia. That's a consideration. But typically it'd be important to consider if you're taking multiple naps during the day and you're feeling really sleepy. That's not normal. Increased sleepiness is associated with increased stroke risk and a bunch of other factors. And so typically that's something to get checked out for if you can't say that it's related to a medication. Having a short nap, in the middle of the day as you get older is probably fine, and you don't feel like you're sleepy in between the naps and you're doing well. I think that's probably acceptable. But if you're feeling like you're so sleepy you need to take multiple naps, that's probably a problem, especially if you're also unintentionally dozing off and things like that as well.
Okay. Next question refers back to, I know you mentioned the decaf coffee, and the question was, does the decaf coffee have the same 24-hour effect?
Well, it depends if you've got insomnia. I think if you have insomnia, what I tell people in my clinic is just remove all the caffeine, including decaffeinated coffee. Okay, for sure has effects. And in different people, it might be different, right? So I'm sorry, I'm just getting a page here. I'm just going to respond to this. Okay. So yes, so for people with insomnia, I always tell people to eliminate the decaffeinated coffee. Yes. It's one of those things that can really disrupt sleep in people with insomnia.
Okay, thank you. Next question is, what about SNRIs?
SNRIs, just like SSRIs, they're good medicines for mood. There's no problem with them. I like them, but you would want to dose them if possible in the morning and not at night. Mirtazapine is an exception because it has an antihistamine effect. So it causes a little bit more sleepiness. So you dose that in the evening. That's Remeron.
And can you just explain what SNRIs are for people?
Okay, so it's a serotonin reuptake inhibitor and a noradrenergic reuptake inhibitor, and it's typically used for mood. And there's nothing wrong with a little bit of improvement in your mood with these medicines. Like I say, I'm not pro sleep medicines, but I'm okay with these, mild mood medicines. They can give people a boost. And so those things increase your serotonin a little bit, increase your norepinephrine a little bit. But I do recommend if people are having sleep problems that those be dosed in the morning in most cases. There's occasionally rare people, everybody's different, where one of those medicines makes people sleepy and they'll dose it at night, but it can also still disrupt sleep. Paxil, being that we're talking about aging, is paroxetine, is one that I do not recommend in older people because it has more anticholinergic effects, and acetylcholine is really important for memory. So I would avoid the paroxetine type of medication. But Zoloft, sertraline, Lexapro, citalopram, those are better. And then there's the ones like Trintellix and effects are also fine. Wellbutrin.
Okay. And our next question is, what is your advice about melatonin?
Yes, I'm getting another little page thing I have to respond to right here, just real quick. Okay, so melatonin, no problem using melatonin. The one thing I would say, we use it for 3 different reasons: for REM behavior disorder, when people are acting out their dreams, for improving sleep onset, and for circadian rhythm to kind of mark the dusk time. But I don't think people need to use more than 1 milligram, at maximum 3 milligrams. I noticed that people get over-the-counter doses of 10. That's way beyond physiologic dosing. So you can get kind of after effects the next day. It can cause a little diarrhea and headache. And so it's just, people think that supplements that you get over the counter have no side effects, but everything does. So I would just use it at smaller doses. At Trader Joe's, you can get 1 milligram, half a milligram tablets, 500 microgram tablets. And we use those when we're trying to advance people's sleep phase. So if somebody's going to bed too late, they keep going to bed at 2, we would give them melatonin around 7 p.m., not when they're going to bed, but very early, because it kind of stimulates the dusk period time. So you don't give it right at bedtime, because then it could potentially delay your sleep phase. So if you're using it for circadian rhythm, you want to take it very early. If you're using it just to help with sleep a little bit, you take it kind of around sleep onset time. If you're using it for REM behavior disorder, acting out your dreams, you can go up to slightly higher doses for efficacy. But if you have REM behavior disorder, you should also be evaluated for sleep apnea, because arousals in REM caused by sleep apnea can also cause that sort of kicking out in your dreams and things. And that's important to treat and not just use melatonin.
Okay. And in terms of herbs such as valerian, what's your opinion about that?
I'm typically, herbs are medicines. Herbs are just like medicines. We just know a little bit less about their side effects and their supplements that they put in with the valerian root. Not infrequently, some medicines are sort of like Benadryl. They're antihistamine based. And with those, then they can worsen restless leg syndrome, So just to keep that in mind, that we don't have all the data on those kinds of things. So I'm not as pro valerian root. I'd rather all of these things we talked about today, like removing the stimulants, making sure your sleep window is around the right time for your good sleep habits, setting that wake time so you don't get up after a certain time. That can be better than trying to use medicines, which I consider valerian root to be.
Okay. Our next question that's come in, and we're going to try and move through these quickly because we have about 6 minutes left, and I don't want to keep you longer than
that's okay.
our
I'm okay to
time.
stay a little longer. It doesn't matter.
So our next question is, what are the differences in what the brain does during deep and light sleep?
Oh, light sleep. Okay, REM sleep is not exactly light. This is too long a question, really, but there are relays between the thalamus and the cortex that happen during slow wave sleep with calcium changes in the cells, and there are things about the hippocampus and how things that have been stored in the hippocampus and memory can go out into maybe the rest of the brain during during slow wave sleep. Slow wave sleep is supposed to be important for memory, as I mentioned. The EEG waveforms look like a big ocean during slow wave sleep, as you can imagine. In REM sleep, your eyes are darting around because it's like you're moving and you're seeing things, and your EEG looks like it's more awake. Those are some of the changes, and they have different, like in REM sleep, you have high acetylcholine, which makes you kind of alert to what you're doing. If you wake up, you're kind of right awake. If you're in slow wave sleep, you don't have high acetylcholine, and when you wake up, you can be groggy and a little disoriented. Those are some differences.
Okay. And our next question is it possible that the clearance of toxins can also stimulate neurons and cause dreams?
I don't think that the clearance of toxins has anything to do with dreams. I've never seen that or heard that, but it's always interesting to have a creative question. I think that the dream onset is more triggered by the cycles of the EEG that you go through at night, and not so much with that glymphatic system. Yeah.
Okay. Thank you. And our next question that's come in is, with insomnia and short nights, does the sleep pattern get condensed so you get the needed time for SWS and REM?
With insomnia and short nights, yes, you don't have to worry about short nights. You do still cycle through the right sleep periods. But, chronic insomnia is not good for you if you're having chronic insomnia. But if you tend to be an insomnia person and you're working on your insomnia, you still get your slow wave sleep and REM sleep. So that's not something to necessarily be worried about. I did see there was something about Tylenol here. I like Tylenol for sleep, for pain. I agree with that. Just don't do Tylenol PM, because that has that Benadryl in it. So that's the key thing. Tylenol arthritis is great for pain, and that's a long-acting Tylenol. You can take that at night, but don't take the Tylenol PM formulation, because that has that Benadryl in it. All the PM things have quite a lot of Benadryl. It's going to affect your memory in a bad way. But Tylenol by itself is good.
Okay. And our next question that came in is in reference to, you mentioned alternatives to the Cpap machine.
Yes.
I think they're having some discomfort with theirs. So
yeah, I think it's worth sticking with and doing adjustments initially, because it is really a very good therapy. Now, if you were in a sleep study where they went to a very, very high pressure, it's possible you would only need a very much lower pressure if you were sleeping on your side. So the combination of side therapy, a much lower pressure, may be adequate for you. The key thing about the mask, if you tend to kind of be a mouth breather and you're on a nose mask, that can be really uncomfortable, because the air goes in your nose and you're breathing, then it's going out your mouth, and it's kind of jars you awake and makes you feel like you're kind of choking. So thinking about that is important. There's a lot of little troubleshooting things to do when you first start on Cpap. I'll give you an anecdote. I saw this very high-powered lawyer in the area many, many years ago, and she had very severe apnea with oxygen saturations, but she had such trouble finding the right mask interface. She couldn't tolerate a full face mask, but she was a terrible nasal congestion. So she opened her mouth during the night, and she was sure she would never tolerate it. But she took like a month off of work and used a nasal mask, nasal pillows with a chin strap. And I didn't see her back, and I just assumed she never got adjusted to it. But 10 years later, or maybe longer, she said, you helped me so much way back then. And I was like, oh, really? Did I? Yeah, because I kept pushing her to keep with it. And apparently it had a huge impact after she adjusted to the Cpap. So it does take a little perseverance. And I do encourage people when they're starting to give it some time, and especially think about the mask interface, and try even lower pressures or something like that, or some combination of things, because it can be very helpful. Though in one night, in a split night, they might not have got the pressure quite right. So talking to the sleep provider about trying another sleep study with just the Cpap may be helpful.
Okay, thank you. Hopefully that answered the question. So our next question is, what do you feel about, what are your views on using melatonin with a Cpap?
That's fine. There's no problem using melatonin with a Cpap. No, but again, just watch the dosage. Don't use 10 milligrams. And if you're having trouble with insomnia and sleep apnea, which is not uncommon, right? You want to do the things that help with insomnia, just like we talked before, with the sleep window and cutting out the caffeine, making sure you get exercise, right? And those kind of things, cut out the fluids and food 3 hours before bedtime. Making sure you get up at the same time, or not the same time every morning, but not after a certain time. So what I tell people is like, you have to decide your boots on the ground time. Now, for everyday life, for many of you, you may not have sleep problems. It doesn't have to be super rigid, but if you think of your boots on the ground time, you don't want it to, if you're really having trouble with your sleep, you don't want that to vary too greatly. So you don't want to wake up one day at 7 and another day at 10:30. And boots on the ground means, why I use that terminology is that just that people tend to wake up and then they might stay in bed. That counts as being in bedtime. But having that wake time be regular is really, really helpful.
Okay. And it looks like this is our last question in the chat. So
Yeah.
it's, how do you know how long your needed sleep window is?
How long your sleep window need is, I would say, that's the point about first decision is, are you a morning lark or are you a night owl? Or you're just in between. So say, I'm just going to give you myself for an example. I tend to be a little bit of a night owl, but on the other hand, I need a certain amount of sleep. So maybe I don't want to go to bed at 9. I want to go to bed around, say, 11. Now, how much sleep do I need? I need about 8.5 hours of sleep. So that's 12. That would be a 1 hour, and then 7:30. So if I were having trouble with sleep, I would need to make my sleep window about 11 to 7:30. So I go to bed after 11 and wake up before 7:30 to have an 8.5 hour sleep need. That's a very snug window that goes right around my sleep need. If I want to be a little more lax, I'd make it 8. Now I could go to bed at 12 and I can go to bed at 1. Remember, I can go to bed later, but I have to get up by that certain time in order to keep myself in the sleep rhythm. If I'm honest about it, I stay up too late. And so then I still have to get up early. So then I get sleep deprived. So that's insufficient sleep, which is a little bit of a different problem. But that's how you make a sleep window, is you kind of think about what your sleep need is. Typically people don't need 10 hours of sleep. So you don't want to make a sleep window from 11 to 8, because look, 10 to 8. That's 10 hours of sleep. If you're really trying to improve your sleep, you want to kind of make that a little more snug around your sleep time. I'm also happy to take verbal, questions from you guys. You can unmute your microphone and talk if you like, and have a conversation.
So and she's clarifying her question just a little bit before we move on. So it's trying to identify how much sleep you actually need.
Okay, so what I would say is just think back to your time when you slept well, when you were maybe a middle age or something, or younger, and you say, okay, when I was in 30s, I never had trouble with sleep. I slept great. Okay, what time was I going to bed? Well, I would go to bed around 11:30 and I had to get up at 7. So then you can think about that. You were thinking really well during the day, you were doing a lot of stuff and you didn't feel too tired. Then you say, okay, 7:30, 11 to 7:30, that's 8.5 hours, right? If on the other hand, you're just saying, well, what's the amount of sleep I need? I sleep fine. Well, then it's sort of just reflecting right now, like, okay, well, how do you feel? And if you feel like you can sleep any amount of time, more sleep isn't always better. You just want to find what's comfortable. And, typically people are, around 8 to 9 hours of sleep. But when you're older, you sometimes don't need quite as much. It might just be 7 to 8 somewhere. But you don't have to obsess about how many hours of sleep you're getting, if it's good sleep and it's on a regular kind of basis.
Hi, I have a question. I tend to get a second wind just before I'm going to bed. I'm watching TV, I start to fall asleep, then I kind of wake up and then I get tired, but then I get a second wind. So I'm a little confused about what that all means.
Yeah. Sorry, my battery was just about to die. I didn't realize. Okay. Second wind. Yeah, well, people do have that. Now, one of the things I would ask you is, are you taking a nap during the day at all?
I used to, but I'm trying not to now. So no, I'm
Okay.
not taking naps anymore.
Okay. Are you doing any caffeine at all?
No, I don't do caffeine.
What are you drinking with dinner?
I don't drink alcohol anymore.
Okay.
I drink water.
What do you drink after
I
dinner?
drink water.
Just water. Okay.
I'm sorry? Yeah.
Drink after dinner water. I think it's hard to know with that. You could need to, you can get, I think you can get a little bit of an increased activation if you're kind of staying up too late for your own body. That kind of gives you an adrenaline kick, you know? But exercise can help you a little bit, calm that tendency, so you're not sort of, you know, getting over excitable. But I have heard that in some people, but that's sort of a theory I have. Now, if you take a nap, though, I would take your nap at before 11, if you can, in the morning, a 20-minute max nap if you really feel like you need it. So set an alarm, and it doesn't have to be asleep, just rest. If you're doing any kind of meditation, make sure you're not meditating lying down, or meditating and having some sort of sleep periods, because people can go into light sleep, and that kind of sops up your sleep drive as well. So you can count that into your nap time if you're having sleep problems at night.
Okay.
But that's a great question. The other thing you may need to consider, and I mean, it would take me a while to kind of go through your routine. That's what kind of asked you about dinner, but you know, what you are doing in the evenings. You want to do some sort of calming or activities. If you tend to, like, for example, watch some kind of movies, and there's so many great things on TV these days and series and stuff, that can kind of get you a little bit riled up because they're so dramatic and everything. You want to make sure you have a little more time to wind down and do sort of calm things, not as kind of intellectually or emotionally engaging. That might be something to consider. Make sure you don't drink or eat in that 3 hours before bedtime window too. I don't know if any of those things seem to, you know, be things that make sense to you.
Yeah, I'll try napping.
exercise.
I'll try napping before 11 in the morning. That might help.
Yeah.
And certainly not drinking anything after a certain hour, because usually I like to have a glass of water or something like that before.
Yeah, those little things can make a difference. What time are you getting into bed, and what time are you getting out of bed?
I usually get to bed around 10:30, and I usually get up around 6:30.
Okay. That's fine. What I would do is just be a little sharper about that. Like, say, if you're going to do 10, get up by 6. Okay. And so if you're going to do 10:30, do 6:30. Do you ever stay in bed after 6:30 and lie in bed longer?
No, not really. When I wake up,
early.
Yeah, when I wake up, I'm an early bird.
You're an earlier, right? Okay. So, yeah, that sounds all right. If you're having increased sleepiness, it may also be that you've got do you have snoring?
No, but my husband does.
I see, sleep disruptor.
Uh-oh.
So sleep disruptors can, you know, be another factor in sleepiness. It sounds like you have a little bit of increased sleepiness is what I'm hearing. You have a mix, but a pure insomnia doesn't give you sleepiness during the day. Exercise is important, mood is important, all those things. And with the increased sleepiness, so sleep disruptors, remember we did that list of sleep disruptors, and that was the reflux, the nocturia, making sure you're not drinking anything 3 hours before bedtime. Make sure you're not doing acidic things at night, and not mint or any kind of like ginger or fruit or things that have acid in them, cranberry juice. Nasal congestion, make sure that's down. And then if your husband's a snorer, have your snoring husband evaluated because they may have sleep apnea. Right. You're doing him a good service. And that might help you because, you know, the Cpap machines these days are very quiet, and they're just sort of like a nice low fan. They're not like the old ones that were louder. The important thing is if your husband is a snorer, that needs to be probably addressed. Side sleep will help. You can also use earplugs. I have a particular earplug that I recommend called Flents, F-L-E-N-T-S, with the sort of the cylinders, and you can use those. That's sometimes very helpful for people. Sometimes you can use like a fan in the background that can be helpful. Sometimes people sleep in separate bedrooms. It's not uncommon just for sleep, and that's not a bad thing. I think there's some statistic like, 15-20% of people who are married and happy still sleep in separate bedrooms, and that can be a good thing too. So there's lots of options there, but I think that's important to consider. Pets in the bedroom can also be one of those disruptors.
Okay, well, thank you very much, Heidi. Appreciate it.
Okay, you're welcome.
So I just want to double check, and are there any other questions for Dr. Roth?
I'm also happy to see people in the sleep clinic. It's always hard to get in, but if you have a sleep issue, I would hope that you can get some, I think everybody can benefit from it, getting evaluated and getting some tips anyway. And hopefully this was helpful. I mean, many of you may not have severe sleep issues, but this was more informational to kind of let you know about things, and you can spread the word.
Yeah.
No question here, but wanted to take a moment and just thank you both for taking the time to do this afternoon.
Oh, you're very welcome.
Thank you so much for joining us. So I want to thank Dr. Roth again for providing such valuable information and for spending time with us this afternoon. This recording will be posted on our Department on Aging YouTube site. So it should be up in probably the next four or 5 days. It'll be up, but I can also send it out to everyone who's attended the program this afternoon. But I just want to say thank you to everyone. Thank you to Janice Tyler, our director, for being here with us and for all of your support. And I hope you all have a great evening.
Okay, thanks for coming.